Which of the following complications is most likely responsible for his cranial nerve findings? 55-year-old. So the answer turns out to be apostate. Okay. 55-year-old man, history smoking, presents with cough, weight loss, and hoarseness. On examination, his uvula deviates to the left, gag reflex is absent on the right. Further investigation reveals a mass in the right lung. Again, which of the following complications most likely responsible for this? So, okay. Off the bat, I like both lung metastasis and Pancoast tumor because I was thinking something after reading those answers real quick. I'm like, okay. Smoking, okay. They don't say how many pack years, so we're not too sure. Cough, weight loss, hoarseness. Uvula D means to the left. I don't know if there's something with does it say petosis? Does it say anything like that? There's a mass in his right lung. Uvula deviation. When I see uvula deviation, I'm thinking usually like the I might be saying Killian, like the Killian's triangle stuff.
Not too much Killian's triangle stuff.
No, okay.
So think cranial nerves.
Okay. So hoarseness, gag reflex is 9. Uvula is going to be 12, I'm pretty sure. So 9 and 12. Where there's going to be direct compression of the brainstem. I don't really like. I think he has lung cancer.
So what's your most likely?
Pancoast tumor. I can't remember exactly what that is. That if Pancoast tumor is like more of a Horner syndrome. She fits some of that. Lung metastasis to the brain. I like. I don't know, but I'm really not too sure about this one. I'm not super confident.
What's your guess?
Because perineoplastic with lung, I'm thinking like SAADH. The lung is just lung. Gut is lung metastasis, but I don't have a good reason for it besides just there's a mass in his lung and there's issues going on in the cranial nerves.
Okay.
That's all. Lung metastasis to the brain. Yeah. So I'm thinking the lung cancer went to the brain. So I would say that's. Yeah, I think so. I mean, with very little confidence, but yes.
So it's actually going to be Pancoast tumor. So let's think about this. So lung mets to the brain. If you have brain mets, right, is it going to be one location or is it going to be multiple locations?
I would think multiple locations.
Yeah, the cells have practically gone to your bloodstream and has metastasized in multiple spots of your brain. It's not usually just one, right? And so you have to think of that's why I said most likely, because then you have to think of what are the odds or what's the chance that you have lung metastases that are very specific to make uvula deviation, to make gags on the right. It's just so right. It's just so
and Pancoast is the right side too.
Yeah, so the Pancoast tumor this is the right side, right? And so your gags are absent on the right, right? And so all this is cranial nerve, like your vagus.
Oh, okay. So I was wrong. Okay.
Yeah, so your vagus is kind of very close there, and so with the Pancoast tumor at the apex of the lung, can have all sorts of cranial nerve involvements. But like you said, perineoplastics, right? Usually not going to be for cranial nerve. You're going to have hormonal issues, right? Cerebral metastasis, right? Brain from another private while can cause neurologic signs. Symptoms are more consistent with Pancoast, right? It's just a better answer. Direct compression of the brainstem. I mean, that's very far from the lung apex to get to your brain. That doesn't really make sense. So that's going to be your best answer here.
Okay.
All right.